VENDLET V5S offers easy and safe moving and handling of the bedridden client. The electric turning system can be operated by one carer, who can stay focused on the client during the entire procedure. One hand is used to operate the hand control, while the other hand is free to guide the arms and legs of the client. When VENDLET V5S is activated by pressing the power symbol twice, the system produces a beep sound, and the green light above the power symbol is turned on. The red buttons activate the red bar. The blue buttons activate the blue bar. When VENDLET V5 has been activated, the bars can be raised. To pull the sheet onto the bar, press the top button with the arrow which is turning outwards. To slacken the sheet, press the button with the arrow which is turning inwards. When VENDLET V5 has been inactive for 90 seconds, the system produces a beep-beep sound. The diode is turned off and the VENDLET system is deactivated. We will now show how to turn a client onto his right side. First, raise the bed to the appropriate working height. Then, raise the blue bar. Wind the sheet up onto the blue bar and guide the client's left arm over the chest. Then guide the client's right arm to the side. Move the hand to the hollow side of the client's knee. When the client is lying in a lateral position, move the left leg in parallel over the right leg. Now the client has been turned. Typically, we would position him in the middle of the bed to create a sense of safety. When turning the client back to supine position, first raise the red bar. Then, wind the turning sheet onto the red bar and place the free hand below the client's right knee. Now move the hand down below the knee towards the ankle and guide the left foot over the right foot to place the patient in a supine position again. Before the client is left in the bed, the turning sheet is slackened on both sides. VENDLET V5S is also used to move the client from one side to the other in the bed. As a safety measure, the bar may be raised a small amount at the side to which the client is pulled. In this case, the blue side. Wind the sheet onto the blue bar. The client is now moved to the side of the bed. When the client is moved back to the middle of the bed, the sheet is wound onto the red bar. Slacken the sheet on both sides. If the client slides down towards the foot of the bed, the VENDLET system can be used to bring him back up. Slacken the sheet on the blue side and slightly raise the bars to create a sense of safety. Lightly grasp the sheet and guide it towards the head end, while the turning sheet is wound onto the blue bar. Stop when the client reaches the edge next to the blue bar and slacken the sheet on the red side. Lightly grasp the sheet and guide it towards the head end, while the turning sheet is wound onto the red bar. Stop when the client reaches the edge next to the red bar. Slacken the turning sheet on the blue side and lightly guide it towards the head end, while the sheet is wound onto the blue bar. Repeat the process from side to side until the client has returned to his normal position in the bed. Finally, slacken the sheet on both sides. VENDLET V5S has an integrated side rail. If the bedridden client needs a side rail, just elevate the bars and slacken the sheet.